The hidden risks of C-sections, understanding the impact on mothers and babies. Introduction. For over a century, childbirth has undergone a dramatic transformation, shifting from a natural life event to a highly medicalized procedure involving numerous interventions. While medical advances have saved countless lives in emergency situations, the overuse of cesarean sections, C-sections, has raised significant concerns. In many countries, C-sections are performed far beyond the 10% to 15% threshold recommended by the World Health Organization, WHO, with rates exceeding 30% in countries like the United States and Brazil. Although C-sections can be life-saving when medically necessary, they often come with hidden risks that affect both mothers and babies. Studies have highlighted the potential for gut microbiome disruption, immune system compromise, increased respiratory problems, and higher rates of chronic diseases in children born via C-section. For mothers, C-sections pose risks of infection, postpartum hemorrhage, uterine rupture, and placenta-related complications in future pregnancies. Understanding these risks and exploring alternatives can empower families to make informed decisions about childbirth. This article explores the impact of C-sections, highlighting potential long-term effects and emphasizing the importance of restoring balance through comprehensive postpartum recovery strategies. The rise of C-section rates, a global concern. C-section rates have surged globally, with some countries reporting rates as high as 50% to 60%. Brazil, China, and the United States have some of the highest rates worldwide. The WHO recommends that C-sections should only be performed when medically necessary, yet elective procedures and non-medical factors have contributed to the rising trend. Contributing factors. Medicalization of childbirth. Modern obstetric practices often treat childbirth as a medical event requiring intervention. Induction of labor, epidurals, and continuous fetal monitoring can slow labor progression, increasing the likelihood of additional interventions ultimately leading to a C-section. Fear of litigation and convenience. Healthcare providers may opt for C-sections to minimize liability risks and manage unpredictable labor timelines. Scheduled C-sections, while convenient for hospitals, often lead to unnecessary surgical births. Perceived safety and control. Many women are led to believe that C-sections are safer and more predictable than vaginal births. However, research suggests that vaginal births are associated with fewer complications for both mother and baby when there are no underlying risks. The hidden risks of C-sections for mothers. While C-sections are often perceived as routine procedures, they are major abdominal surgeries that carry significant risks for mothers. 1. Increased risk of infection and blood loss. C-sections increase the risk of postpartum infections, hemorrhage, and excessive blood loss, which can lead to prolonged recovery and, in severe cases, life-threatening complications. According to a study in the American Journal of Obstetrics and Gynecology, infection rates are 5 times higher in women undergoing C-sections compared to vaginal deliveries. 2. Prolonged recovery and chronic pain. Recovery from a C-section is longer and more painful than from vaginal delivery. Many women experience pelvic pain, abdominal adhesions, and scar tissue that can lead to chronic discomfort. Scar tissue can also impair uterine function in subsequent pregnancies, increasing the risk of placental abnormalities. 3. Future pregnancy complications. Women who have had C-sections face a higher risk of uterine rupture, placenta previa, and placenta accreta in future pregnancies. Placenta accreta, where the placenta grows too deeply into the uterine wall, can lead to life-threatening hemorrhage. 4. Increased risk of hysterectomy. Severe postpartum hemorrhage or placental complications may require an emergency hysterectomy, leading to permanent infertility. The impact of C-sections on babies. C-sections also have profound implications for newborns, affecting their immune system development, gut microbiome health and long-term health outcomes. 1. Disruption of gut microbiome development. Babies born via C-section miss out on exposure to beneficial bacteria passed through the birth canal. This lack of exposure alters the development of the gut microbiome, increasing the risk of asthma, allergies, autoimmune conditions, and metabolic disorders. Studies show that infants born via C-section have reduced microbial diversity and a higher prevalence of harmful bacteria compared to those born vaginally. 2. Increased risk of respiratory issues. Vaginal delivery helps clear fluid from a baby's lungs, reducing the risk of respiratory complications. C-section babies are more likely to experience transient tachypnea, neonatal respiratory distress syndrome, and other breathing difficulties due to the lack of hormonal and mechanical stimuli associated with vaginal birth. 3. Higher incidence of neurological and immune disorders. Studies suggest that C-section births may be linked to higher rates of autism, ADHD, and other neurological conditions. Additionally, C-section babies face a greater risk of developing type 1 diabetes, obesity, and inflammatory bowel diseases later in life. Restoring microbiome balance through vaginal seeding. To mitigate the impact of C-sections on the infant microbiome, vaginal seeding has emerged as a promising practice. Vaginal seeding involves transferring maternal vaginal fluids to the baby's mouth, nose, and skin immediately after birth. This practice introduces beneficial bacteria to the newborn, supporting the development of a healthy microbiome. Although vaginal seeding shows promise, its safety and efficacy require further research. Healthcare providers should carefully assess individual cases to determine whether vaginal seeding is appropriate. Supporting C-section recovery strategies for mothers. For mothers who undergo C-sections, comprehensive postpartum care can promote healing and mitigate long-term effects. 1. Scar tissue management and myofascial release. Scar tissue can cause adhesions and chronic pain. Techniques such as myofascial release, massage therapy, and gentle stretching can improve mobility and prevent excessive scar tissue formation. 2. Nutritional support for tissue repair. A nutrient-dense diet, rich in collagen, protein, omega-3 fatty acids, vitamin C, and zinc supports tissue healing, reduces inflammation, and aids recovery after surgery. 3. Pelvic floor therapy. Engaging in pelvic floor physical therapy helps restore core strength, improve bladder control, and prevent future pelvic dysfunction. 4. Probiotics and gut microbiome restoration. Introducing probiotics and prebiotics after birth can help rebalance the infant's gut microbiome, reducing the risk of long-term immune dysfunction. Probiotic strains such as Lactobacillus and Bifidobacterium support microbial diversity and immune health. 5. Hormone balancing and stress reduction. C-sections can disrupt hormonal balance and increase stress levels. Practices such as meditation, gentle exercise, and adaptogenic herbs can support hormonal regulation and reduce stress, promoting a smoother postpartum recovery. When are C-sections medically necessary? While C-sections pose significant risks, they are life-saving in certain scenarios. Medical indications for C-sections include placenta previa or placental abruption, conditions where the placenta covers the cervix or detaches from the uterine wall; fetal distress, when the baby shows signs of oxygen deprivation or severe distress during labor; maternal health conditions, situations where vaginal delivery poses significant risks to the mother due to pre-existing conditions; breech or transverse presentation, when the baby is positioned in a way that makes vaginal delivery unsafe. Conclusion: C-sections, while necessary in some cases, come with significant risks for both mothers and babies. Understanding these risks and exploring alternatives allows families to make informed choices about childbirth, For those who undergo C-sections, implementing comprehensive recovery strategies can promote healing and reduce long-term complications. By restoring balance to the microbiome, supporting tissue repair, and addressing pelvic health, mothers and babies can achieve optimal outcomes after C-sections.